fully aware of the promise that was made by the Utano Paw concerning the statistics on drug abuse. It's very important. I'm very sorry for it as long overdue, but we're currently working on it. Let us stop drug abuse and save lives.
Okay, welcome. I know we've been waiting for this video tatakamirira kuti tiwane this information for a very long time, and now it's here. Drugs and substance abuse. So we're going to, we are not celebrating that this abuse is good, but we are just acknowledging the fact that when we learn about this abuse, we will be able to prevent it and take measures that show responsibility. Okay, so don't get it wrong. Let's start with the definition of drug. A drug is a chemical substance which modifies or has an effect on or in the body and the body's processes. This is a human body, when ingested or introduced into the body. It can be a human body or an animal, but we are mainly focusing on the human body. And we go to the next point, which is drugs are divided into two general types, which are prescription drugs and non-prescription drugs. Very important note. But we can add a third one. These are just two general types, but the third one, which touches on the misuse of drugs, which we can then call the misused drugs. They are non-prescription but also misused. So prescription drugs are prescribed by a licensed medical practitioner, and the patient that receives these drugs, which are safe for medicinal purposes only, take note of that, is supposed to take them under the guidance of a licensed medical practitioner. It's important to get that prescription from a licensed medical practitioner, not just anyone who claims to practice medicine. Selecting the right dose of a drug is not easy. That's why you need this licensed practitioner, because of the next point, which says, but it has to be accurate in order to avoid side effects and the abuse of the drug. Your health is priority, so you want to be careful where you get your prescription, because you might end up abusing the drug. Then we have non-prescription drugs. These are safe drugs which can be sold or used without the prescription and supervision by a licensed professional. They are safe for use, so you can go to the pharmacies. This is why some people, you find them, they go to pharmacies and they get the medicine that they want or they need. So you don't really need to get a prescription for these, because they're safe for consumption. It's only those that are a bit dangerous, those that need guidance when taking them. Those are the ones you may need a doctor or licensed medical practitioner to prescribe the needed doses, so that you do not abuse the drug willingly or unwillingly. Then we have examples of non-prescription drugs, which are pain relieving drugs like ibuprofen and paracetamol, which is also known as acetaminophen. And then in America, by law, it's also applicable to some other countries, these drugs are referred to as over-the-counter drugs, which is shortened by OTC. So that's why I was saying you can go to pharmacies, you can go to shops, you'll find such drugs, but it's not all drugs that are sold over the counter or by any retailer. Then these drugs are not just sold right after they are discovered, because we need to be careful about the drugs that we are receiving. It's like, for example, with the current pandemic that we are in, these vaccines didn't just come exactly when they were discovered. They had to be tested. The same way we have copyrights in content creation is somewhat similar to patents given to an inventor who has managed to produce a new drug. So the drug will be approved for sale over the counter after a certain period of time, which is specified in the patent, and it depends on the law of the country of origin. We all know there are people who may want to take ownership of the things that do not belong to them, people that want to steal the credit. So we may need to acknowledge that the inventor of the drug or the person who has discovered the drug for a certain period of time. That will be stated in the patent. And there's also different ways of naming the drugs, but in those ways there are specific ways of naming that are supposed to be followed. There are certain principles that are used in naming, even if the name will not attract customers in the in the stores or the shops for these non-prescription drugs, it still needs to follow that way of naming, so that people are not confused about the drugs they're taking, in order to avoid those mistakes. Because these drugs, if they are misused, it's unfortunate, you can actually lose your life. So the last part is, many drugs we use come from plants, and as we now know, their sole purpose is to cure diseases and heal wounds. Nothing else, nothing more, nothing less. That's basically the core reason. It's just to help the immune system. Before we look at these definitions and explanations, I just want us to agree. If I mention some big words here and I don't explain them, I'll try to break it down so that it's simple to understand. But if I break it down and then I end up mentioning more big words which you may be unfamiliar with, then I might suggest that you search on the internet and get clarity. But I'll try by all means to break it down. So the first one is antibiotics. These are substances which specialize in destroying bacteria without harming other living cells in the human body. Then a depressant is a drug which enters the nervous system and reduces the efficiency of the nervous system. A stimulant is a drug which increases the rate of the nervous activity. So don't mistake the two. A depressant is for reducing the efficiency of the nervous system, and the stimulant is increasing the rate of nervous activity. Then the next one is an addictive drug, is one which causes a person to become dependent on it. Addiction is not a new word. It will be hard for a person or for the person to quit taking the drug without suffering severe psychological and physical symptoms. We also refer to these symptoms as withdrawal symptoms, because usually these symptoms are experienced by those who are withdrawing themselves or quitting an addiction. These are headaches, anger, dizziness. It can go on and on. Anger, which can also be the psychological, and headaches and dizziness are the physical. The intolerance is a case when a person's body doesn't respond to a drug in the normal way. The next part is actually the important part for understanding tolerance. It says, and the person has to take more of the drug to obtain any feelings of pleasure. So it's not about curing anything, it's just for feeling of pleasure. So now we're going to look at some medicinal drugs. We can just make it the umbrella term for the non-prescription and the prescription drugs for medicinal purposes. So as we now know, antibiotics are substances which specialize in destroying bacteria without harming other living cells in the human body. That's basically the aim of a drug. It's not to harm the body. This is why any drug that has a potential of having side effects needs to be prescribed. Antibiotics mainly come from fungi. They are made by fungi. And penicillin, which is an antibiotic used to stop new bacterial cells from making other cell walls, which leads to their death, was the first antibiotic to be discovered, and it is made by a fungus called penicillium. Penicillin from penicillium, that's where the name came from. The problem we face is that bacteria mutate or develop resistance to the antibiotics. That's very common, but we just need to take note of it. So there is a need to discover more antibiotics, or the best idea will be to develop a drug which can destroy the source of the bacteria and prevent the production of the bacteria. That would be a very good thing to look into. If you are a scientist out there, you might need your help in this area for preventing these bacteria, because we want to avoid the next thing that we'll mention just now. One way to prevent the development of resistance to antibiotics is to use antibiotics when they are needed only. For example, for treating infections according to a prescription, and not for preventing them. So if an inventor invents some drug which is separate from these antibiotics, I think if anyone wants to prevent or wants to be immunized against certain bacteria, it will be easily done without having to create yourself or make yourself a good habitat for bacteria, for this bacteria which would have mutated or developed resistance. Then we go to the next point, which is the reason why antibiotics cannot damage viruses is that viruses don't have cell walls. So the main idea for destroying bacteria is centralized on the cell walls themselves. They're the ones that protect the bacteria. But viruses, they don't need the cell walls. Then we look at anesthetics. These are drugs which are introduced into the body to induce insensitivity to pain. These drugs are commonly used during surgery. For example, when a dentist is removing a tooth. Yeah, I think most of us have experienced that when your milk tooth is being removed. When you're still young, the doctor has to inject something on your gums and on your mouth, on your lips rather, and that brings the numbness that you feel. Yeah, that's basically the insensitivity of pain that has been induced. Other surgeries, like when doctors are removing cancer infected area, it will take hours, probably something like 8 hours. Some surgeries last for around 6 to 8 hours. So there are some anesthetic drugs which are administered to the body to last for those hours until the surgery is completed. So now we have reached the gist of our presentation, the main thing that we wanted to touch in this presentation. Before this, we're just trying to break this misconception that drugs are bad. It's not all drugs that are bad, it's just some are misused, and then we have medicinal drugs as well, but we have these misused drugs. The first one we're going to look at is alcohol. This is a very common misused depressant. The first point says this is one of the misused depressants and it is very addictive. That's common knowledge. We have seen drunkards. If you haven't seen drunkards, then just wait for your time, you will see them. Estimates say around 70% of young people have had a drink. So it's quite possible that amongst the 70 there, you can have around 40%. Let's say roughly 40%. Of those 40%, you'll find one whom you bump into and will be drunk. Consumption of a great percentage of alcohol can lead to the reduction of self-control. Now that's the bad part of it, because it has very big or very terrible social effects, social problems that come with lack of self-control. And the next point says after drinking this depressant, it is quickly absorbed into the bloodstream through the stomach walls, and it is transported to the liver where it will be broken down. In accordance with the definition of a depressant, we can say alcohol slows down a person's reaction time, and this is evident in the effects of alcohol abuse, which include blurred vision, slurred speech, poor judgment, and poor muscular coordination, just to mention a few. You will see it if you bump into a drunkard. You will just see all these things manifesting. Some of the extreme psychological effects of alcohol abuse are aggression. Not in everyone. There are people that we know can have lack of self-control, but are not aggressive. It's just that, one or two incidences they won't be able to control themselves. Then there is loss of memory and confusion as well. And large consumption of alcohol can also lead to coma and even death. You can just go flat and sleep for hours and hours as if you are in a coma, and some actually die because it disturbs your brain functions, and too much of it can disturb your brain, and livers as well can be affected. It's just a whole lot of junk. Then the next one is the psychological problems can then lead to some social problems, which include neglecting responsibilities. Like you're a father or you're a mother, you don't take care of your children. That's the most common one. Or you're not even attending work. Then you also experience violent behavior. That's also part of lack of self-control, especially towards family members, and you are also most likely going to be involved in crime or even causing the crime. Now we're going to look at one of the most dangerous drugs in the world, and this is heroin. Probably many of you have heard of it. Heroin is a highly addictive depressant. It's not like alcohol, but it's also highly addictive. Found in opium, and the opium is produced by opium poppies. Heroin is used in medicine to relieve pain. These two sentences should be able to enlighten you on why it is very addictive. The common way of introducing this drug into the body is by injection into the veins, and it is transported through the blood to the brain. When heroin reaches the brain, it is metabolized. The metabolism is the synthesis or the process of breaking down the heroin to morphine, which mimics a neurotransmitter called endorphin, which helps. This endorphin helps to reduce the sensations of pain, hunger, and thirst. That's a very important point to note, which introduces the idea of the addiction. And this leads to the feel-good experience. That's where the addiction comes into play. So this will negatively affect the brain's production of natural endorphins and other natural neurotransmitters. Very terrible, because if you stop taking this heroin and this morphine is not introduced into the brain, therefore you won't have the reduction of the sensation of pain, hunger, and thirst. You just have it, and it will be a terrible experience. You need these neurotransmitters, so it's better if one does not take heroin. Then, to show that this drug is addictive, an addict exhibits withdrawal symptoms. These are unpleasant physical reactions experienced by an addict when they want to quit an addiction. Withdrawal symptoms include anxiety, hallucinations, stomach upsets, goose pimples, or what you call goosebumps, and diarrhea. That's just to mention a few. And then that's after a couple of hours without the drug, which explains why they need to inject and not consume through the mouth. They need to inject so that it quickly goes to the brain and quickly avoid these withdrawal symptoms. Then the next point is other problems with heroin abuse are addicts neglect responsibilities, and the high chances of poor addicts, the people who are addicted but they are poor, to share the same injection needles with people infected with HIV and hepatitis B, because they're not able to purchase new needles, so they still need that heroin because of these withdrawal symptoms. They want to avoid them, so they'll keep these needles and they use them with the HIV infected people and people with hepatitis B, and that's how the transmission of these two infections come to the people, and it's very terrible. And this results in transmission, as I said. Then also malnourishment is experienced since the drug depresses appetite, and heroin abuse is or can be lethal. We just explained the part where we get the malnourishment, because if you get too much of it, you're going to lose appetite, but you still need nutrients in your body, and if you steal your body of nutrients, then you're just doing disservice to yourself. So the addicts need to be careful of that. So let's move on to anabolic steroids. These are drugs which stimulate metabolic reactions in the body cells, causing a buildup of large molecules from smaller ones. A natural hormone like testosterone causes protein to be made in muscles, therefore making the muscles grow larger and stronger. And that's when you work out. You don't just get it when you're seated. The testosterone works when you are working out. These steroids will cause muscles to surpass the normal size and strength of the muscle tissue, and this is what some athletes desire to have in order for them to have a competitive advantage. Quite unfair. To make the competitions fair, anabolic steroids are banned in sport. I think we just need to acknowledge that, someone has been working for years and then you come with your steroids. It will be unfair. It will be unfair. Then the next point is, although the goal is achieved, the goal of gaining these muscles and the big size and the strength, it comes with a terrible price to pay. The effects are very terrible. Anabolic steroids reduce the efficiency of the immune system in combating infections. Very scary. They can harm vital organs like liver and kidneys. Even more scary. And males who take these steroids have a higher risk of developing prostate cancer. Cancer is the rapid division or uncontrolled division of cells. And females who take these steroids are likely going to experience inconsistencies of the menstrual cycle. Now we move on to our last misused drug, which is tobacco smoking. So tobacco actually needs prescription. You can't just take it like when you smoke. But many people are smoking it almost every day. Some even smoke it in their couches, and there's a whole lot of stuff. So let's look at the problems. Why is it bad? The smoke affects the health of both the smoker and the non-smoker. So if the non-smoker is in the proximity of a smoker and they inhale the smoke, they are likely also going to face some side effects. To understand the effects, let us look at the components of the smoke. We have the first one, which is carbon dioxide, which is that formula CO, chemical formula CO. It's because, and the name carbon monoxide is named like that because there is carbon, the carbon atom, which is bonded to one oxygen. That's why we have the prefix mono. If it's dioxide, the di means there are two. That's why it's called CO2, dioxide. That's basically the idea behind it. Then this is a colorless, odorless gas produced during the incomplete combustion of carbon. That's the most important thing to take note of. It's colorless and odorless. That's why it's very dangerous. This gas combines with hemoglobin, which helps to carry oxygen in the blood. Carbon monoxide reacts with the oxygen to form carbon dioxide, which is the unwanted gas in the blood, and loss of oxygen leads to death. So carbon dioxide is the one that we exhale, and we inhale oxygen. Pregnant women are advised not to smoke because this gas negatively affects the fetus in their wombs. The fetal growth is affected. If a full-grown person can suffocate because of this excess carbon monoxide on their surroundings, then the fetus is threatened by this gas. So we need to prevent that. Then the next part is nicotine. This is an addictive stimulant which causes constriction of arterioles. These are small branches of arteries which lead to capillaries, thus increasing blood pressure, which leads to hypertension. Hypertension is the great psychological stress due to high BP or high blood pressure. There are also high chances of developing coronary heart disease, CHD, commonly known as CHD. I think it's also called coronary artery disease because it involves the arteries that surround the heart. Then we have smoke particles, which are particles which cause mucus hypersecretion, which means that excess mucus is being produced more than the norm, and increase in bacterial infections. They also cause chronic obstructive pulmonary disease, which is known as COPD. That's the most common one, caused by smoke particles in the body, and they can damage the lining of respiratory passages, which causes chronic bronchitis. Bronchitis is the inflammation of the lining of bronchial tubes, which are responsible for carrying air to and from the lungs. Now we look at tar. Tar is a substance which contains carcinogens. Carcinogen is a substance which is capable of causing cancer in a body of a living organism. It causes cancer on the living tissue, and this causes lung cancer and increases the risks of developing other types of cancer. Cancer, sometimes how it behaves is, if it infects one organ, it can even enter the bloodstream and travel and go and affect other organs and other parts and other tissues. So that's how it also increases the risk of infecting other parts of the body, and that on its own will cause death. It can even lead to stage 4 cancer, and when you're declared to be in stage 4 cancer, it's very depressing, and there's nothing we can do about it. Of course, there are other examples like cocaine, marijuana, cannabis, and other substances like glue. We know street kids in some streets are sniffing glue as we speak, and it's a very bad sign in our streets there. But this presentation was just to try and help us understand why drugs don't need to be abused, so that we save lives. By now, we should appreciate that if we didn't have drugs in our day and age, with all these viruses, diseases, and injuries that we face in our day and age, many lives would be cut short and many people would suffer immense pain. It's a pity that some people misuse drugs willingly or unwillingly, and they will consequentially harm themselves. Looking at the statistics, you find that young people when they reach the age of 18, they become very experimental, and you see, you have had the bulk of your teenage years aspiring to consume some of these substances, to smoke. You have been aspiring to drink, and then when you're 18, that hype then comes, and you want to drink, you want to experiment everything. But it's just advised that you tone yourself down, lower the pride, just keep it simple. Don't be overhyped by these things that are deadly. If you are a fellow young person, please take advice from me and from the Utano Paw. It's one thing to enjoy that thing, that substance, that drug, and it's another to pay the price, the consequences that follow. I would like you to revisit the address by Madam Vice President, the highlights from the Europe Regional Summit, the part 1, and on our YouTube channel. It's on our YouTube channel and on the blogs. It's very important to note one of the points that you say we should not annoy doctors with unnecessary problems, because these things can be prevented. So be aware of these things. And the next point says koshesa yambiro yamunopiwa nawa nachiremba vezo utano, which translates to respect the advice that you receive or you get from medical doctors. It's very important because they're the ones who are licensed, and they are the ones who are responsible for taking care of your health through their prescriptions. And you should also take good care of your own body. This is why we have this program called Personal Health Analysis in the Utano Paw, so that we encourage you to take care of your own body and not abuse drugs and substances.